So let's talk about this counterintuitiveness to including the favored parent in therapy. So you just separated or you just finalized a divorce, but there are continued high conflict parent issues that are affecting the kids. And worse, your children are starting to reject you at some level. And sometimes that happens in the intact families. You start to see those dynamics begin to take hold, but certainly post-separation and divorce. So if those are the factors in your life, why would you ever want to include the ex-spouse or ex-partner in the reunification process, as often ordered by the court? All right, well, let's go through some of the following. So number one, there were reasons that there was a divorce, obviously. Maybe you were physically or emotionally abused. That's a very common dynamic in these high conflict personalities. Maybe the other person does have a high conflict personality disorder, or certainly the core traits. Maybe you lost your sense of self along the way as you tried to over accommodate to the high conflict parent, and you lost who you are somewhere. And you never thought that you would have to deal with that person again post-divorce, save for the children, correct? Meaning there would be minimal contact, minimal interaction, minimal effects from that parent on you, towards you post-divorce. So I'm going to pause here and introduce why it's very important that we attempt to include that favored parent. This is what we want to avoid. So we know from research findings the following, and this is just a sample of the research, that children exposed to high conflict divorces are the following. 65% of these children had anxiety severe enough to require counseling or intervention. More than half developed an attachment disorder. Again, they were forced into the position to have to choose one parent over the other parent, disengage from one parent. So it affects attachment, that basic core that we have in our ability to connect with people and trust. Almost half of the children who came from high conflict divorces had fears and phobias that were abnormal, out of context, given their current life situation. 44% externalized the stress that they were feeling in the high conflict divorce, and they became physically aggressive. 31%, or about a third of these children, had sleep problems. So that's an indicator that the basic functions of that child's body were being affected. Sleep being a very important piece of growth and development for children. So what about the research for previously alienated children who grew up and became adults? Again, this is what we want to avoid.